And some other health-related stories. Non-Governmental Organization Curious Minds Ghana is advocating for a community policing policy to tackle the high and growing incidence of teenage pregnancies in the country. This comes as part of recommendations from research based on the situational analysis of young women's access to sexual and reproductive health services. There's more in this report.
According to new research by a non-governmental organization, Curious Minds, and the Sociology Department of the University of Ghana, 60% of rape cases in coastal areas in Ghana are treated as family matters, which leaves the culprits unpunished. The research also found high level of early sex debut attributed to waning influence of cultural and traditional moral codes. Nia J. Soa, who is co-researcher for the project, spoke to GHOne television.
The most important thing we found is that people are having sex very early. I mean, as young as 8-9 years having sex. And that is translating into early pregnancies. And it's also further translating into abortions, unplanned termination of pregnancies. As much as 70% of the people we reached out to had been raped before, which is very concerning. And one of the violations is also coming from, unfortunately, our health service providers, where the treatment given to persons who try to seek some of these services are seen as denial.
The Curious Minds group says the fight is to contribute towards attaining Agenda 2030.
Agenda 2030 will not begin in the year 2030. We won't wake up in 2030 and look at the results that we are achieving as a result. As a result of what we are doing now, what is important is that even as we live now, we are contributing towards that same sustainable development goals. So the little steps we take, the micro efforts we make now is what will culminate in the success we want to see.
According to the group, Ghana must find a solution to the ailing problems of sexual and reproductive health services which plague our nation.
So in health,